Okay. All right, recording's going. So first off, welcome. This is the second of our corporate sponsor highlight series that RHAU is doing. We are blessed to have several really strong corporate sponsors that are providing a lot of support for RHAU, and we want to highlight what they do and what they bring to rural Utah so that we make sure people are able to connect with them. And today's highlight is on UHIN. We have Vali Chidabaram, the Director of Clinical Health Information Exchange at UHIN, who is joining us today. Vali has 11 years of experience in the interoperability space, including several years leading public health informatics and data exchange initiatives for the Utah Department of Health and Human Services. And she works across multiple generations of data standards, from traditional HL7 messaging to modern Fire API, and has spent her career building and modernizing security systems that help keep data moving forward, health data moving forward. And then joining Bali is Jeff Larson, who has been on the leading edge of technology his entire career and has brought that expertise to UHIN. He came over about 4 years ago, and Jeff leads the solutions powering claims and revenue cycles with a specific focus on provider billing. And lately, he's been tracking the shifting landscape of CMS mandates for prior authorizations and attachments, which, as we all know, feels like a bit of a moving target right now. So we're incredibly lucky to have his leadership and guidance in the state for those solutions. I'm going to turn the time over to Bali and Jeff, and then we'll go until 1:30. And if you guys have questions, please put it in the chat box or raise your hand, and we'll see if we can get to those as we go through the presentation.
Great, thanks, Casey. We're really grateful for the opportunity for this partnership with RHAU and for having us here today. So I wanted to start by giving you a quick overview of who we are, what we do, and why UHIN was created in the first place. UHIN was created in 1993 by the local healthcare community here in Utah to address the shared data exchange challenges they were facing back then. The community saw the need for a neutral, central organization that could bring healthcare organizations together and help information flowing across. More than 30 years later, that remains at the core of who we are. We are locally governed and community-led, aligning our priorities constantly with the needs of Utah's healthcare community. And I think it's one of the things UHIN and RHAU have in common: strong belief in bringing people together to solve shared challenges, right? So Clearinghouse supports the exchange of claims and other administrative transactions, while our Clinical Health Information Exchange, or the CHI, brings together patient information from across care settings in the state. So UHIN supports so many of you, so many healthcare organizations behind the scenes, that you may know us for one aspect of what we do, but not necessarily the others. So we just wanted to give you a quick look at the full range of our products and what we offer today. So I'll start with the CHI, and then Jeff will walk you through the work we do through our clearinghouse. Okay, so what exactly is the CHI? The CHI is the only state-designated health information exchange in Utah. We securely collect and share patient information across healthcare organizations, creating a longitudinal view of the patient's health history. Today, many EHRs offer connectivity through their national networks. They are all valuable, but they are generally limited to the organizations connected to that particular network or consortium. The CHI, on the other hand, we go a step further. We bring data together from many different EHRs, hospitals, clinics, labs, payers, public health entities, and more. So the CHI was originally launched through a federal grant, and today it continues as a community-supported resource. And there is no cost to contribute data to the CHI. And the more organizations participate in the CHI, the stronger it becomes and more useful for everyone using it as well. One thing that we would like to emphasize to our partners is that CHI is not the responsibility of a single organization. It's a shared resource, and we rely on the healthcare entities in Utah to do their parts and share information, share complete, accurate, timely information with us, standardized data with us. And if you're interested in exploring how your organization could participate with us, you see a QR code in the screen here. Clicking on it will take you to a short survey form. Tell us a little bit about your organizations, your goals, and we can follow. Our team will follow up with you to discuss how the CHI can help you. Moving on to this slide and the next, I've listed all of the offerings that come out of the CHI, and I thought it would be better if we anchor them in a synthetic patient story. So let's call the patient Mary. Mary is 76 years old, lives in rural Utah, has multiple comorbidities. She has, let's say, hypertension, high cholesterol, osteoporosis, chronic pain in her neck, hip, shoulders. So she sees her PCP that's close to home, but she also has had specialty care and procedures in other parts of the state. That means pieces of Mary's story lives in many different systems. This is where that she starts to bring those pieces together. We receive the data from several hundred sources, and our identity, I wanted to really quickly highlight so you are following this with a couple of slides here can be very noisy. Let's see, this works. Okay. So we have our master person index or our identity resolution process that actually works to recognize that the Mary seen at her local clinic is the same Mary who's had imaging at another facility and has seen a specialist in a different hospital, right? In those individual pieces, they form the longitudinal patient record in our system together. Now, let's say Mary travels to Salt Lake City to visit her family. While she's there, she's had a fall, ends up in an ER that's outside of her health system that she normally uses, right? So because both facilities, the ED department and her PCP's office participate in the CHI, her primary care team can now receive ADT alerts about her admission at the ER center. The ED clinicians may also need more context than what exists in their EHR. So we have several different ways to make Mary's, this longitudinal patient record, available to the ER physicians. Information can be delivered in the backend to the EHR vendor of the ER provider, and they can then integrate directly into the provider's view through what we call the results delivery, or the providers could go look up the patient in our patient portal, or their system can query the CHI to retrieve the information that we have on Mary. So there are multiple ways for physicians to pull information for Mary at the point of care. The next slide continues with the services that we offer. So let's say if Mary's provider subscribes to our risk scoring service, the discharge alert may also include a LACE scoring that shows her risk of readmission after hospital discharge, or a false risk score providing insight into her short-term risk of falling, which can help them prioritize follow-up, essentially. For organizations that contribute data to us, we also can support by providing supplemental data for select HEDIS measures. That means fewer chart requests for you from health plans, and less time your staff spends chasing pulling records. No, we support a couple of measures now and are expanding from there, basically. We also, not in the list here, we also participate in a couple of national networks, PCDH, Patient-Centered Data Home. For example, if Mary were to visit an ED while she's traveling outside of the state, we could receive that ADT information and route it back to her CAT team here. We also participate in another network called the eHealth Exchange, where participating organizations can query the sheet for patient information. The remaining services here don't really fit into Mary's story, but I really want to point out that we do offer public health reporting services where members can send reports for syndromic surveillance, immunization, and ELR messages that we would route through to Utah's Department of Health and Human Services. We also get death notifications from the Office of Vital Records from DHHS, and which we can then share with partners that have signed up for that service. That does come with an additional cost because we get charged by DHHS for this. Direct mail is just one way to make secure information available to providers. All right, moving on, I just wanted to show some screenshots of our portal. Again, following with Mary's story, Mary's providers can open her record in the SHE portal and see information from many organizations. They can see allergies, the substance reaction when it was reported, where that information came from, all of that. They can view diagnostic imaging reports. Oops, I think I skipped. Let's see. Something's wrong with the animation here, but it is strange. It did skip a couple of slides where I wanted to show you the screenshots. Essentially, we bring a wealth of information about Mary, encounters, diagnosis, medications, procedures, clinical documents, and more, all contributed by basically different organizations across her care journey. I'm sorry for the hiccup here. Let's just move on. So everything I've just described here, the data coming together, the exchange of information, the alerts, the portal, all of this requires more than just technology. And UHIN provides the basic building blocks, the technology infrastructure, the data platform, the interoperability mechanisms that make data exchange possible. But the healthcare community provides the governance through shared policies, agreements, and the trust that has been built across the community. And I also want to say that our clinical data repository vendor is high trust certified. UHIN is also what we call a SOC 2 Type 2 certified, essentially to highlight our privacy and security practices. Right, and let's move on to the next slide. At the core of the SHE is our clinical data repository, or what we call the CDR. We moved to a modern Fire-based platform a couple of years ago, and the data is also stored in a Fire-based data warehouse in Google BigQuery. And we're also in the process of moving a lot of our services into AWS cloud environment as well. So these changes have significantly improved how we operate in the last few years. We can now query very large volumes of data much more efficiently and scale well as the volume of data and the needs of our healthcare community grows. And the SHE can actually also help with cost savings for participating organizations. Instead of having to build and maintain separate point-to-point connections with every partner they need to exchange data with, they can just connect with us once and use that shared infrastructure for multiple exchanges, right? And that can reduce interface development and maintenance fees. It can also reduce legal and administrative burden of negotiating separate data sharing agreements, BAAs for every individual connection. And also a more complete picture of the patient with complete diagnosis codes, for instance, can support more complete and accurate documentation, coding, risk capture, and help with reimbursement for you guys as well. Okay, and this chart here really shows why bringing data together from very many organizations actually matters. So we looked at patients receiving care from 5 major health systems and clinical groups here in Utah. And we asked a very simple question: over a 4-year period, how many different health systems did those patients actually visit? And you can see that, very few patients stuck to just that healthcare facility. At least 80% of the patients we can see that ended up going to multiple organizations. This is exactly why we exist. We help bring back those pieces together into a more complete longitudinal picture for the patient. And then, and this is what the participation adds up to. You can see that how our coverage is at present in Utah. 33 of the 34 acute care hospitals contribute data to us today. 10 of the 13 critical access hospitals participate. There are still areas that we are working where we want to grow: behavioral health, small and specialty providers, pharmacies. We are continuously working through those gaps to increase participation in the CHI. Then I wanted to give some time to Jeff. I know I'm going over. Finally, I just wanted to show example success stories that we've posted on our website as well. Granger Medical Clinic uses our alerts to strengthen its transitional care program. They reduce their admission rates from 23% to 9%. And then Tanner Clinic, on another example, they also used CHI feeds and laced risk scores and reduced their readmission rates from 11 to 4%. And with that, I'm going to pass on the baton to Jeff.
Thanks, Ali. So I'm going to be covering our clearinghouse, specifically around one of our offerings, our My UHIN. Our clearinghouse started over 30 years ago. My UHIN, that was where we started. We had our payers and providers that came together to, figure out a better way. And even after doing so, with many connections through secure protocols to softwares, we found some of our smaller providers needed additional resources, whether it's they needed a low-cost option or they needed even a gap filler, something that one of their other solutions wasn't doing for them. So we came out and we built our My UHIN Claims. It is an online billing and claims management software. Like I said, it was designed more for your solo practitioners, maybe some small practices, but we've also had some of our large provider networks use it for specific reasons, and we're really happy about this product. Our system is a nationwide network. We're connected to really just about every payer out there, and we're very easy to use. It's reliable, has a lot of offerings. We've got teams. We do have an enrollment team that helps kind of walk people through the process of getting enrolled and getting set up from the initial sign up. And then we also have an amazing customer support team that are very knowledgeable, and we've just enacted chat support. So, we had phone support, we got chat support. So we've got a lot of resources for our customers to interact with us and our product. Next slide, please. So right here is our MyUHIN claims, the features that we offer. We've got like the enrollment. We've got electronic eligibility requests, so you can check and see if the insurance a patient has is active. Professional claims, institutional claims. A big one is COB, or secondary claims. We've found a lot of customers find our service or our offering in that works a lot better than some of the other solutions that they currently work with. So we've got a lot of features for a very affordable product. Next. So one of the features we have, I'm going to highlight, is our templates. Within templates, you're able to go in and fill out some of the fields and save them. And so that way you have most of the claim form filled out that fits that particular payer or patient, saving time. Whether you have multiple users that can submit more identical claims with less effort, and or specific payer codes or requirements that just help get those claims through the system the first time. Doing that can help submit claims faster, be more productive in submitting in a lot less time. And we also don't limit how many templates you want to create. So the more insurances or tricky patients or just common claim forms that you do work through, you can create as many as you need. Next slide, please. So right here is a view of our current templates form. So you're able to see the specific name you might want to assign it, the billing provider, the location, the payer, and the type of claim it is. And here it has an actions drop down that allows you to use a template, duplicate, whether if you want to just change maybe one thing for another person or another insurance, you can kind of take what you've already created and create another one, edit a particular one, or just get rid of one altogether. So we're really making it very user-friendly, interactive, and very easy to use. So very awesome product, and we just want to make sure people are aware that we've got things to help facilitate getting claims done maybe more accurately, more often, and also possibly save you even a little more time in submitting your claims. Next slide, please. Here's our claim list view. This is kind of the primary view a lot of people work out of our software. It seems to be resonating really well with our customer base. We've moved the status column. It's filterable, and the actions kind of move with the actual statuses. So we've made it more user-friendly, more straightforward. We've brought the paid amount to this view. All of these things were made possible from listening to our current customers. That's where we're working hand in hand with our customers to offer a better product, have a better product. And to do that, we actually, on our MyUHIN homepage, we offer a portal linked for customers to provide us feedback, to help maybe find new ideas to use, maybe improve, and we welcome all feedback. We love it, and we realize that it's our customers and us together that can collaborate to really make an offering like that. And a lot of softwares out there, they're so big that if you have a suggestion, you're probably never even going to get responded to. So we feel like we've got a great system and a great partnership with our customers, and keep on looking forward to following that model going forward. Next slide, please. So these are some of the quotes from some of our current customers. It's easy to use. They use additional softwares, United Healthcare, Availity, some of the other clearinghouse softwares. But overall, they found that ours is easier to use. It offers more information in centralized locations. It's just overall a very easy, user-friendly tool. And that's what we want to make sure our customers have. Next slide, please. As we wrap up today, I want to bring back to the core of mission of UHIN. interoperability for all, better costs, and better care. We are proud to be a secure data backbone for Utah, ensuring your team has the information they need right when they need it. But we can't build a connected ecosystem alone. A massive thank you to the Rural Health Association of Utah. The work they do has strengthened and advocates our the rural clinics and hospitals, and it's very vital. And we're proud to partner with them and ensure that geography is never a barrier for great healthcare. Thank you for spending your time with us today. We hope that what we presented and some of the solutions and offerings we have are something that might help your work and workflow today. And we encourage you to come and visit us. I believe there's a QR code here you can scan, help get you to some of our teams to discuss things. As well, we have an email, I believe, that shows a way of emailing us, that we have our support teams that can also take stuff, and some of our customer support teams, or our sales teams as well, can take questions for you. So thank you again, and we couldn't be happier to be here.
Thank you, Jeff. We really appreciate your partnership as well. We really feel like UHIN plays a crucial role in some of the next steps we need to take as a state with interoperability and connectivity. We do still have about 2 minutes. The slides will go out. So if you didn't get the QR code or the phone numbers or emails, you'll get a copy of these slides. But is there any questions from the group while we still have 2 minutes? I highly encourage you to connect with UHIN if you have questions, if there's anywhere where you think you could partner together. UHIN will also be at the RHAU conference this fall on November 4th and 5th. Registration is open for that as well. If you're interested in coming, I'd recommend registering early. With the Rural Health Transformation Program going on, there's a lot of excitement behind the conference, and we will probably run out of spots. So with that being said, thank you all for joining us today. We appreciate you being here, and we'll see you at the next webinar or conference.
Thank you.
you.
Thanks, everybody.
Casey, Jeffrey Valley.